Good afternoon. My name is Mike Cavalier. I am Deputy Emergency Management Coordinator here in Natrona County. So thank you guys for coming to today's news conference. So throughout Natrona County and the state of Wyoming, they're highly skilled and trained first responders, health, education, and other leading officials who are proactively working to implement precautionary public and safety measures as related to the COVID-19 outbreak, the disease caused by coronavirus. In Natrona County, we maintain an emergency operations center that remains on standby to utilize in support of events outside of normal operations. This center is staffed with local agencies that play a critical role in the management of any current or future public impacts of COVID-19. This benefits the community by bringing together a diverse representation of leadership across multiple agencies to facilitate the flow of resources, information, and incident management across these organizational lines. Natrona County agencies represented in the EOC include the Natrona County Sheriff's Office, Natrona County Emergency Management, City of Casper Police Department, the City of Casper, Casper Natrona County Public Health Department, Dr. Dowd, Natrona County's Public Health Officer, Wyoming Medical Center, Natrona County School District, Casper Natrona County International Airport, Natrona County Fire Protection District, Casper Fire and EMS, Evansville Police Department, Evansville Fire Department, American Red Cross, Wyoming Rescue Mission, Casper College, Casper Mountain Fire Department, and Bar None Fire, as well as others. Within the EOC, a joint information center has been established. The JIC is comprised of public information or affairs officers from the represented agencies. A list with the contact information for those points of contact will be provided to all media partners in attendance. The Joint Information Center plays a key role in development and delivery of coordinated interagency messages. The designated public information officers within the JIC are committed to providing our public with the most accurate, consistent, and timely and complete information related to the information and operational updates of this COVID-19 situation. So if more information and updates develop, media briefs will be held daily, Monday through Friday, as needed at the Casper City Hall location at 1 p.m. Notifications about these briefs will be sent out via email. So at these briefs, PIOs will disseminate accurate and timely information on the incident scope, size, and community impact, resources committed, and any other matters of public information as related. At this time, I'm going to turn the podium over to the Casper Natrona County Health Department.
Good afternoon. I'm Haley Bloom. I'm the Community Prevention Officer, or the Public Information Officer for the Casper Natrona County Health Department. Thank you for joining us today and for your assistance in providing up-to-date factual information to our community surrounding coronavirus, otherwise known as COVID-19. The Casper Natrona County Health Department would first and foremost like to thank our Natrona County, City of Casper, outlying jurisdictions, and the countless community agencies and groups who have helped and supported our work on this illness so far. As of right now, we currently have no confirmed cases of COVID-19 in Natrona County. However, we do have one statewide confirmed case in Sheridan County. Due to the many unknowns of this virus, the susceptibility to certain populations, and its easy transmission, the Natrona County Health Officer, Dr. Dahl, has had to make very difficult decisions. Yesterday, as you know, he made the decision to cancel the Wyoming High School Activities Association 3A, 4A state basketball tournaments. This decision was not made lightly and was made to attempt to reduce the risk of transmission within the community to Natrona County residents and guests. Late yesterday, Governor Mark Gordon also recommended communities with events or large gatherings of over 250 people work with health and elected officials to determine if these events should be canceled. If you have an event of over 250 people, you may contact us at covid@cnchd.org, and we will work with you to determine what measures should be taken for your event. Large event cancellations have been widely used and accepted as a legitimate epidemiologic tactic to prevent or slow the spread of disease in communities for decades. As we are seeing around the world, without measures like these, those who are sick could easily overwhelm our healthcare system. The Casper Natrona County Health Department recognizes the heartache, disappointment, and inconvenience that this decision for cancellations has caused. For that, we sincerely apologize. We do not take our job of protecting the public's health and the community's health lightly, and we feel we must continue to do this as the virus begins to spread more widely in Wyoming. It is likely we will continue to see more and more cases of COVID-19 in our state and eventually here in our community. I want to assure you that we are prepared and are working together with our partners for the best possible outcomes. The Casper and Natrona County Health Department has set up a hotline for people to call for questions on coronavirus, get more information, or if they have symptoms and do not have a primary care provider. This line is currently operating Monday through Friday from 8 a.m. to 5 p.m. If you're experiencing symptoms, please call your primary care provider first. Again, if you do not have a primary care provider, you can call our hotline at 577-9892. Again, we do not want citizens self-reporting to the emergency room. This places unnecessary burden and risk onto our medical services. However, if you are experiencing significant shortness of breath, please call 911. Due to the increase in call volume from our hotline, if you need help with information, events, or things unrelated to symptoms, you may contact us by email at covid@cnchd.org. Please understand that we are experiencing an influx of messages, calls, and other communications, and we're working very hard to respond as soon as possible. But please know it may take us some time. If you end up sick with COVID-19, the following recommendations for comfort care are below, as there are no specific medications or treatment for this illness. If you have a fever, use a fever reducer like ibuprofen. Stay hydrated and drink lots of fluids. Use cold and flu medications for the treatment of symptoms or to increase comfort. Stay home and rest. Stay home and isolate as much as possible from other household members. Clean surfaces and objects frequently. Cleaning and disinfection is important to contain the transmission of the virus within the community. CNCHD recommends people follow cleaning and disinfection recommendations put out by the CDC. Most common household disinfectants are expected to kill COVID-19 and other viruses. A dilution of 1/3 cup bleach to 1 gallon of water should be sufficient. For additional information or for a list of EPA-approved disinfectants, you may visit the CDC's website. For more information about coronavirus, please visit cdc.gov. For local information, we encourage you to visit casperpublichealth.org or our Casper Natrona County Health Department Facebook page. Otherwise, we will continue to push out information through appropriate media channels, our website, and Facebook page. I will now take any questions anyone may have. Yes?
What happened with the Home and Garden Show?
So we did not cancel the Home and Garden Show. There are plans for elected officials and agencies to discuss that event this afternoon. So the cancellation would have came from the organizers themselves.
Okay.
Yes.
Any suspected cases in the Trump County?
Not at this time.
Have you tested anybody here today or recently?
We currently still do not have tests at our office. Whether other healthcare agencies have sent tests into the lab, I'm unsure of that.
When are you expected to get those tests?
We're hoping that we get those today, but we don't know for sure.
Once you get tests, is anybody eligible to come get those tests, or?
So mass testing is not recommended at this time. So we are following a strict protocol set in place by the CDC and the state health department to determine if someone's symptoms and exposures fit to be tested for COVID. Otherwise, we're not indicating for mass testing just because there is limited supply of tests in the nation.
What type of individuals would be priority for testing?
So we go through a whole questionnaire, and their healthcare provider goes through a questionnaire with them to determine what kind of symptoms they have, what kind of exposures they possibly may have had to make that determination of if it's worthwhile to test.
If someone tests positive, just what kind of would you guys be looking at shutting down restaurants that they may have eaten at in the last 48, couple weeks, or would you be looking at what kind of preventative measures would you be looking at?
That all depends on a case-by-case basis. So we always do contact tracing for anyone that would test positive, so identifying anyone who may have come into contact with them, and then working with our health officer and other health officials to determine what the best steps would be for those individuals.
What about a place like the library specifically? Because that's a place where a lot of at-risk older people go to, and it's a great place for bacteria to spread.
So I think that a lot of agencies and like community places are working really hard to make sure that they're disinfecting and cleaning at an increased rate. So I would just say that, you know, all of those places should be cleaning and disinfecting surfaces.
You talked about the events larger than 250, right? But do you have any advice about smaller events?
Yeah, so we're just recommending those standard precautions right now if events are taking place. So encouraging hand washing, encouraging events to have hand sanitizer and other things available. People who are sick should not be going to these type of events. And then disinfection of surfaces. Okay, thank you.